Good day and welcome everyone to Inspiring Hope, a show that shines the light on amazing people who are making a difference in our world. I'm your host, Lois Hermann, and today I am honored to welcome a truly insightful guest, Marianne Hennigar. Marianne's a fellow hypnotist, a licensed mental health counselor, and a dedicated pain management specialist who has developed an innovative approach called Psycho-emotive Anatomy, or PEA for short. So get ready for some deeply inspiring conversation about the mind-body-spirit connection, hidden wisdom within discomfort, and the empowering journey of truly learning to listen to our physical and emotional selves. Marianne, welcome. I'd love for you to share a bit about your journey. What inspired you to combine hypnosis, counseling, and pain management into your unique approach? How did you end up with that?
Well, first of all, thank you so much for having me. I'm very honored to be here with you. So combining that, it was a long process. I started out as a pain management specialist, as a massage therapist back in 1994. I had always had a gift for touch. I had worked on my mother from childhood because she had chronic, unexplained pain.
Wow.
And so, it was through that desire to help her with her pain that eventually I went to massage school. It was either welding school or massage school.
It's kind of the
And
same. One's working with the human body, and others working with.
learned how to weld.
I love it.
Yes. And so, just as an aside, I've had a dual career as a fine art sculptor and painter as well.
Yeah.
But my main creative focus now is in helping people help themselves. And so, as you can well imagine, as anybody who's ever been in the helping profession, if you're very good at what you do, and I was very good at massage, which I don't do anymore, you get dependency from your clients if they can't get pain relief elsewhere. And it was a bit of a selfish move to start to develop psycho-emotive anatomy because I realized that I had to show people how to help themselves rather than have me be that's it for pain management.
Right.
And so I noticed correlations all over those years between what people were reporting as I was working on them and specific body parts. And so I thought, there's a pattern here. So
Yeah.
I started recording and then reporting to the clients. And I would use a non-leading line of questioning to help figure out what was going on in somebody's body. I'll give you an example. One of the first persons that I started realizing this with had chronic pain back in her shoulders. Now, this client was a secretary in a church, and the pastor that she worked with had a temper. And she would often work very long hours, and then he would not appreciate her work. So we realized, the more she feels unappreciated, the more this part hurts. And
Right.
so what we figured out is as she was able to vent verbally about that, and I found that even without touch, the pain would relieve. And so what we came to in the long run with client after client is that the seventh cervical vertebra can mean or be indicating hurt feelings or the activation of the negative voice within. If it's an accurate to that client pinpoint, the pain very often goes away. And that is the marker for a correct pinpoint. It's not something I came up with. It's not me channeling anything. It's actually the body deciding that it did not need to get attention with pain because it had been heard with what it was expressing in her lived experience.
That's brilliant. So that's where your hypnosis comes into play, learning how to ask the non-leading questions, one, and two, learning or paying attention to the body's wisdom and what the body wants to share and the trapped emotions, because a lot of hypnosis is based on releasing those emotions that we have stuck in us somewhere. So that's just really brilliant how you
Yes,
manage
well,
to do
it's
that.
brilliant how the body is made. And, we are endowed by that which we all come from to have these innate healing mechanisms, and we don't always know how to harness them. But my method is so incredibly simple that pretty much anybody can follow it.
Wow.
And so with the psychoemotive anatomy, that is the theory of the language of pain. And then the hypnosis part, which I discovered after many years of more training in somatic arts, I developed and have a trademark for a mechanism called guided focus in Technicolor, and otherwise known as G.F.T Flow. It's easier to say that.
Mhm.
And what it is we harness the sensations of the body, certain exercises which release the housed energy. And I stopped saying trapped because it's not really trapped. It's just housed there. And
Ah,
the linguistics of it are
just
important.
just renting space. It's not
Yes,
necessary.
yes. It's my mother used to say turning down the page of a book is dog earring. So it's a dog earring inside the body because this thing that we reside in is a giant recording device. And
Mhm.
everything we've ever experienced has gotten recorded and is somewhere in the soma.
Hmm.
And so we use the guided focus in Technicolor to get a focal point, engage with that focal point, and I'll show you my kit. Here's my kit that I use with a telescoping wand. The client gets to choose the color, and we have a whole bunch of different colors.
How fun.
And the client will focus after we've found where in space this thing needs to be. And it'll be an intuitive, yes, stop there. And so as we get going with this experience, the client becomes mesmerized in an open-eyed hypnosis.
Mhm.
And then the body starts talking because it's super chatty. And so we use different tools to pin the areas. And there, people have awareness of themselves that they didn't have. And they realize that the body, as it chats either through pain or sensation, is really our very best ally.
Wow. I know I could only imagine that children would love this technique. Have you done a lot of work with children? Because I know in working with children with hypnosis, many times they don't close their eyes. They're not like, close their eyes and they're gone forever. They might close their eyes for a minute, but they're up and about and they're in a trance state naturally most of the time anyway. So I could imagine that this would be a fun and fascinating way to assist children.
It's very efficient in terms of processing, and children do love it. And what I haven't done more with is the parents pass on the techniques to their children. And so they make it part of their family life.
Hmm.
And so we'll have, if there's a 4-year-old who's gotten a little dysregulated, one of our exercises is go push the wall. And they'll go push the wall and release that energy that's
Right.
inside that is causing them to have trouble with communication or with emotional regulation. And so I'm in the middle of finishing up writing my self-help workbook, which is called The Journey. And it outlines these exercises. And it also talks about the body quadrants, the different parts of the body. And what I have seen to date, people are indicating what's happening. Like the shoulder pinion here. Very often people think, oh, I got rotator cuff problem or this, that, and the other. It may be a transitory feeling, or it may become chronic if their lived experience is chronic, because the body escalates when we don't listen to it or we don't know to listen to it. And so the shoulder pinion for many people has come to represent resentment towards another.
Mm.
And the resentment towards another, if it's, I've found in the work on the right side, is regarding often a female, resentment of another female, or if you're a female, could be self. Left pinion is resentment, often represents resentment towards a male figure. Again, if it's an accurate pinpoint, the area stops hurting. It is amazing.
It is amazing. And I have to admit that I did a session with you and it was fascinating. Now, I tend to be what we call a somnambulist anyway. I love hypnosis. I do a lot of self-hypnosis and meditation and all that. So I'm a very easy subject to go into trance. And you had that little ball there, and the open-eyed strategy worked beautifully for me because I could focus on the ball and immediately my mind went to some memories that were long since buried that just poof popped up relative to the issue that I was dealing with. It was fascinating, fascinating.
Yeah, and I love the way you describe that, because when people come into the office, they say, I don't know what to talk about today. And I'm like, your nervous system has something in the queue. It's ready to go. And we come up with all sorts of wild things that we never thought, but
Mhm.
just talks about how, and it's another thing that I'm writing about called the ages of self. The
Okay.
ages of self is the different earmarked parts of ourselves from different ages that may not have processed
Mhm.
old experience. It could be from a small something, a little T trauma, like falling off your tricycle at 3, a mom wasn't there to pick you up and hug you,
Right.
on to all the things that we would call big T traumas that are rather obvious.
Mhm.
And so they're in a stack. And the further back we go, I have found, the further back we go, the more of the stack that it's like Jenga. You don't topple the tower from Jenga from the top. You want to get down low. And so that is what I have found in my own experience, is how people release old experience that's maybe informing their today.
So the,
And of
as
course,
they release with Jenga, as they release an old experience, does it have an effect where it releases multiple things that are tied to it? Because I know we speak of the initial sensitizing event in the world of hypnosis. So in other words, we could have an early trauma, like the child that fell off the tricycle, mama wasn't there. And that could be somewhat of an innocuous situation. But now there's a compounded situation where there was something happened and mama wasn't there, or a safety figure wasn't there. And so it gets compounded over time, and the issue becomes bigger, 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 more out of control in a way, more or taking over control in a way. So as you're going back, you're pulling out different things with the body itself. The mind body will let you know which one it's safe to go to. Is that the way that it works?
I don't know if I would characterize it as safe. It's what I believe, that we become readily aware of parts of our history as it is useful to us.
Okay.
And so this is the difference between what you and I do and say talk therapy, in
Mhm.
that you don't have to bring up the traumatizing event or actively remember it to
Mhm.
be able to release the energy that's held in the body.
That's
And
wonderful.
so,
Yeah.
yes, so it makes it so that especially people who have lived through very difficult situations,
Mhm.
either victims of some type of violence or environmental things, they're going to have parts of their memory that are not readily available, and that is a beautiful mechanism our brain does in the form of dissociation, which
Mhm.
is an incredible important tool to preserve the psyche.
Absolutely.
And so, but the neocortical brain does not have to be aware of the specific memories. And so many people talk about parts of their childhood that they just don't remember. Well, it was necessary
Mhm.
to not necessarily to have those memories readily available, but you can still process the energy behind it.
Absolutely. And the body, the subconscious mind is fascinating, and that's the mechanism that it is a self-preservation mechanism that will close off that memory, and the person doesn't have a conscious awareness of the memory, but it is stored in the body in some way. So going back and releasing it, we're releasing the somatic connection to the memory is what you're talking about. And I know that many times with hypnosis, I've had clients that have gone into a memory, they've processed it, they've come back out of trance, and I'll ask, what do they remember? And they will not remember that scenario. The subconscious mind said, okay, you process this, we're going to close it right back up. And the goal is that's fine, that you don't need to touch it. And this is part of why I'm a firm believer in not necessarily recording and giving sessions to people, because if your subconscious mind has closed it back up, then that is your mechanism for self-preservation and for strengthening and moving forward into the next phase of your life.
Precisely. I agree with you completely. I do, in my sessions, record a portion, and the portion that I do record is simply the cherry on the top of the ice cream part, which is the actual closed eyes experience that we'll go through, which only lasts about 7 to 15 minutes, very short. And only so that it's useful to the client. If it's going to be, processing a lot of old memories, then I don't record that part of it, because they don't need to relive that. But say they want a hypnosis for sleep or for changing their relationship to food, then these very short recordings can be very reinforcing. And also, I love the fact that it gives the client so much monetary value, because they get to enjoy their session over and over again. And it makes me feel like I've really given back to them that little bit extra.
Yeah, that one you're basically giving them the positive, the end point, the positive affirmations that are the empowerment part of the session, which I think is really brilliant.
Yeah, yeah.
Wonderful. And you've just you told me that you've just sent your book off to be evaluated or
Edited, yes, I've got somebody cleaning it up, and I think they're in Zambia.
okay,
So but I went through a service to find them.
okay.
And so I'm very excited that this self-help workbook, which is about 32 pages long with illustrations and exercises, will be an item that can stand on its own, that people don't necessarily need to see me in order to start working the exercises and helping themselves. It's not that I'm trying to fire myself, but my job is to spread this information as far and wide as I can. And so it gives me great pleasure to make this workbook. And hopefully the current clients will be doing a little beta test on it and helping me work out the specifics. But it's been in the works for a long time.
And that's a really valuable tool because you and I have spoken about this before. There are people who come to a hypnotist or a somatic healer wanting to be fixed. Fix me, fix me. And we know that the person who is going to have the biggest transformation is the person who is willing to fix themselves. We are healing facilitators. We give them energy. We help them based on the knowing that we have. And each one of us, your technique is unique to you and my techniques are unique. This is why we can support one another, because different people, different clients are drawn to different practitioners based on what their focus is. Yours is definitely focused on pain because of your background in that. And when we have somebody who then wants to become dependent on us, that's not what we're after. We are looking to empower people like you. Now, you are a licensed therapist. I am not a therapist, and I proudly say I'm not a therapist. I don't analyze. That's not my thing. My job as a hypnotist and an energy clearing expert is to clear the energy, pave the way for self mastery and self transformation. So, what you've done with this workbook is given, excuse me, given the client the tool to empower themselves, which is so
Correct.
critically needed.
Very correct. And that's the thing too, if you had told me back when I started out as a massage therapist, and I thought, oh, people really seem to be responding to this. If you had told me then that you can't heal them, only they can heal themselves.
Mhm.
We have all the mechanisms. We are divinely made with all the mechanisms. And I'll give you a little example. Say I get a cut on my arm. My tomcat reaches up and he gives me a little scratch. And I don't have to do anything to it. I don't have to think it thick. I don't have to think the scab into existence. It'll form a little barrier. That'll bring white blood cells in. It'll reknit the tissues. And then I'll end up with a scar. But that scar tissue is stronger than the surrounding tissues because of the way it reknit.
Mhm.
And we have those mechanisms within ourselves that if we're given optimal bumpers or framework, our system will heal itself. And that's why the work that I do, and likely the work you do, is never exhausting to me. It's always uplifting. It's always interesting to watch people grow. What I do, I can't call it therapy. And I have to say, I do have a master's in counseling, but for the kind of counselor that I am, the licensure is not required because I am a pastoral counselor with
Wow.
a specialty in trauma. So I lead with the hypnotist again.
Mm.
But the thing is that when I say, I'm not allowed to say what I do is therapy, but it does have therapeutic results.
Absolutely. Yes, we absolutely. And it has therapeutic results for those who are open and willing to receive. And I'm sure you have the same situation where people come and they'll say, make my pain go away. And they won't allow themselves to be responsive or to really embrace the skills and the techniques and the tools that you have developed over a lifetime. If they're not willing to do what it takes to shift their own patterns and behaviors, then there's only so far they can go because they have to take responsibility for their healing journey. You cannot rely on someone else. This is one of the problems I find with our medical community is they're just giving out drugs like candy. And so the drug then masks the real issue that it helps the person on a short term, but over the long term, the issue is still there. It's just hidden behind the medication. How would you address that?
Well, I had the dilemma before of, okay, I know this person's on 2 or 3 different medications.
Mhm.
I know that it doesn't make them feel good. How do I work past the drugs?
Right.
And that's an interesting dilemma. And I did have an interesting thing happen many years ago when I was working with a lady who was in an adult facility because she was older, and she had terrible kidney damage, and she was on medication for her kidneys. And some friends said, would you please work with her? And at that time, I had her lay on a magnetic mattress, and
Okay.
I did some hands-on work on her, very much just as a presence and a healer, because she
Mhm.
probably didn't get touched very much. And
Sure.
so having somebody actually touch her, and she loved the session, goes away, and they told me 2 days later, oh my goodness, she had to go to the ER. And I'm like, what? And they're like, yes, they realized that what they found that was wrong with her is that her medication now is too high a dose. They had to reduce her medication. So I was able to work past the drugs
Mhm.
enough,
Mhm.
or she was able to work past them enough to
Sure.
heal, but then her dosage was too high with the medication,
Mhm.
which was a
Exactly.
fascinating thing.
Yeah. Yes, I
And
have
so
had clients who have weaned off of their medication based on their sincere drive to get better and their applied focused energy to shift their patterns and habits in their life to let go of the things that are keeping them stuck and have been able to wean off of medications, of course, with their therapist or their doctor's monitoring. But it is amazing how we have our bodies are incredible, how we can heal. We have all of that innate ability. We just have to learn how to tap into it. And it sounds like you have developed some very interesting, unique tools to help people to do that.
I've been really blessed in my lifetime to train with a bunch of very smart people, who are willing to reach for novel approaches. And some of these approaches that, kind of my method is in the tradition of, because we all have those who came before us, right?
Right?
Some of those traditions are one that's very known to regular medicine, which is EMDR. It's
Yeah.
known that in psychological, it's very accepted. The work that I do with the G.F.T Flow comes directly out of the training of somatic experiencing, which is a 3-year training program, and brain spotting, which grew out of another thing, which is another mechanism or method that grew out of EMDR. So we're all in a lineage, and looking at a little bit different part of the picture. So say you and I were standing on the street, and you're across the street and I'm here, and there's a red car. You're going to see that car from one angle, and I'm going to see it from another, but we're both looking at the red car.
Right.
So it does take all of us.
Mm.
And you caused me to think when you were speaking of that phrase, healer, heal thyself.
Mhm.
And that's truly, we are all the healers of ourselves.
Mhm.
So if we could be given some guidelines, an owner's manual, so to speak, as to how to help our vehicle, our lives improve.
That's so true. We're not given an owner's manual for being a parent or for helping ourselves. And as we mature and we learn so much, it also through experiential learning, we try different things. Well, my body doesn't particularly like this. For instance, so many people love, love, love yoga. My body does not like yoga. I know this sounds weird, but it's just the way that my spine is positioned to get on the floor and do some of those positions, I end up in more pain. So, an upright type of yoga, yes, but so many people love yoga and it's wonderful. For me, not so much. I'd rather do some sort of movement or dance or some levels of workout. So, each one of us learns what our bodies need. And as we discover and develop our awareness and we tap into our own unique way of healing, then we have the ability to embrace different types of techniques that weave together for the ultimate healing journey.
Yes, I so agree with you on that. And a great example too is like so often people try to get into a meditation and their mind won't calm down.
Mhm,
And they try, and maybe sometime they'll like catch the thread of that a little bit. With this open-eyed method of hypnosis of the gift flow, your mind goes where you're trying to go with meditation, whereas you may not have sequential thoughts until a memory pops up. You may just be focused on the focus.
mhm. And it
So
takes the pressure off. When you're not going to close your eyes, because a lot of people are afraid, if I close my eyes, am I doing it right? Am I doing it right? So the just look at the ball and what comes up. So it's very interesting how your technique releases the pressure for some people who have to prove that they can do it. And so therefore
yes.
they can relax and just spontaneously do it, right?
Exactly. And there's not an expectation, we very often people report, as you saw, looked at the sphere, people will eventually, if you stare at it for a few minutes, it can be as little as 30 seconds, you'll start to see this mirage effect around the sphere, and it won't be that same color. And as that happens, that technicolor effect occurs. It's the same thing we've been doing since we were little kids, and we called it daydreaming, or could be spacing out a little bit,
Mhm,
but it's that hyper broadened focus
mhm,
that allows us to come home to ourselves, quite literally. And I've heard people describe it as that if, say, their color or their light goes away for a minute because they got into the thought universe and they're like, where's my light? I'm like, it's there. If you've seen it once, you're going to see it again. Don't worry.
mhm,
It can sometimes be elusive, but that has to do with meaning making in the brain rather than feeling and flowing.
mhm,
And
mhm.
so I hear that, as you've been describing, you're able to flow easily.
Yes, I enjoy the flow. Let me tell you, I enjoy the flow. And I think also once we mature beyond the need to perform, the need to be
Mhm.
perfect, then we can get back into that childlike flow state of daydreaming, of imagination, and that we often dismiss in the young children. And it's almost as if we are returning to that creative, spontaneous flow mind state that a child would naturally have unless they're put in a seat and told to sit down, shut up, and speak when they're spoken to, which is so many. That's what our
Right, right.
systems most of the time, most of them do, instead of allowing the child to explore nature and put things in their mouth and throw things and lay down and get muddy and dirty because they're in the flow of nature. And so they're taken out of that in our current system. In most cases, not all, but in most cases, they're taken out of that natural flow state and they're forced into a shoe that really doesn't fit them. And that changes everything for how they process, how they relate to themselves and the world around them. So it sounds like what you're doing is helping people to get back into that childlike flow and just to spontaneously allow the flow to come through and speak to them through their mind, body, and spirit.
Yeah, yeah, I completely agree with you. And that's what's so interesting too, in that I watch children in their body behaviors. And that's how I learned some of the exercises that I offer people. One such exercise from watching children is walking in a circle that feels better.
Mm,
So and I invite a client, if they're activated in their body, and of course, our big buzzword these days is triggered, right? But
mhm,
if their body is activated and there's energy that's mobilizing for fight, flight, freeze, I may invite them. Could you go over to that other side of the room and walk in a circle that feels better? Experiment with one direction and
mhm,
experiment with the other, because the direction that is in the direction of where their internal spin is
mm.
will cause them to be wobbly and unsteady on their feet. And so
Absolutely.
what we're doing is activating the counter vortex to the vortex of trauma, which is a term of Peter Levine's. Uh, and so when you do that counter vortex simply by moving, it's enough to release and neutralize the energy. And it's the simplest thing in the world. You see children walking in circles all the time.
Mhm, mm.
They're self-regulating.
Does that happen with our cats too? When our cats like chase their tail and spin in a circle?
I think that's called the zoomies.
That's that too.
But it is a release of energy.
Yeah.
However, again, in the tradition of Peter Levine with somatic experiencing, these exercises function counterintuitively, which is if you do a motion very fast, you're expressing the energy. If you do the motion slowly, you are giving a chance, and you shake, it causes you to shake, you are releasing the energy.
Hmm.
Fascinating. So Peter always says, fast is slow and slow is fast.
Okay. Hmm.
Very interesting. And
Very
another
interesting.
example is stretching the human body. I'll put on my massage therapist hat. You don't want to say, if you're trying to stretch, you don't want to bend down and bounce. You don't want to do explosive stretching because it has a snapback effect with your muscles. It's not good for them.
Mhm.
So anybody who instructs about stretching will say slow and sure. And that gives the muscles a chance to elongate. Also, the fascia gets very fussy if you try to yank it around. It's like a Chinese torture thing, that you put on your fingers. If you try to pull real hard, you can't get your fingers out. But if you relax, you can get your fingers out.
Interesting. Yeah.
Really
Yeah.
interesting.
I just read somewhere about the fascia that we have. Our body has crystal fibers in the fascia, and that if we just even rub our skin and rub those fibers, it activates, it stimulates the crystalline fibers within our body and helps it to heal, helps it to promote energy. So,
Yes, and also you're at the same time working the lymphatic system as well, because lymph only moves with muscular movement or actual hand stroke. That's why I love to tell people, if they want to help themselves, swim. If you're somebody who likes to swim, swim as much as you can, because it has a chiropractic effect, but also because it evens up the muscle tension in the body, harnesses your core, but then also has a massaging effect on the body as your body resists the water. And so it's just good for you all the way around.
it has the buoyancy where your weight, if you're carrying a little extra weight, it's harder to move on dry land. But in the water, there's a buoyancy to where your muscles, you can move more fluidly.
Yes. And also, there's something so magical about being in water.
Mhm.
So
Yeah.
one of the things that I sometimes bump into when I'm doing a closed-eyed hypnosis, and they're never scripted. Very often people work from a script. I do not. It's inspired. It's like somebody whispered in my ear.
Mhm.
One of the things that I have said to people, if I brought them out on the shore and they're near the beautiful big ocean and just feeling the energy, and I remind them that the ocean, both you and the ocean, are made up of water,
Right.
and you can synchronize your tides, your internal tides, with the beautiful ocean. That seems to have a comforting effect for people.
And both are salt water too.
And both salt water, exactly.
Yeah.
So
Wonderful. Wow.
just the idea of conductivity, very interesting as well, because that's when we get more into the mind, body, spirit. We're
Right.
conducting elements of spirit through ourselves as living beings.
I'm seeing more and more people talking about the spiritual aspect of the self in the threads that I follow and on social and in the news types of programs that I follow. And I love it. I mean, this has been something that I've been involved in 30 years. And I had a coach, goodness, at least 10 or 12 years ago said, don't tell anybody about the spiritual stuff that you do. Just focus on mind and body. And it was hard because I was so aware of the spiritual nature of self. And it's rewarding now to see more people coming to the awareness of how important the spirit is to the overall sense of self. So, how do you incorporate spirit into your mind body? Because a lot of the somatic, what you're talking about, is mind body, and you use spirit as well. How do you incorporate
Well,
that?
you can't help but bump into it. And so, first, as most practitioners would have as part of their greeting of clients, especially newly greeted clients, is to find out if their spirituality is a resource. Because some people have institutional wounding from church or from, could be any organization. And so it's hard for people to separate their church experience with their beeline to the thing that we're all made of, however you want to identify it. And so I'll find out what degree of that there. But for myself, I have a spiritual experience very frequently in any of the, whether it's breath work, hypnosis, dream time, meditation. I bump into Christ all the time, and I'm just thrilled to pieces to see him.
Yep.
And I have another client who, she kept seeing Ganesha in the room with us because of her faith.
Right.
But it's all spiritual. I mean, we all have blood flowing through our veins, and we all have the potential to tap our sense of spirituality if we want. And so, yeah, it is so beautiful now that people are not trying to quiet us around that. And if it's not a resource, we don't have to go there.
And you're right. A lot of people are confusing religiosity with spirituality. There is decidedly a difference. I often relate to, spirituality is the whole pie. Religiosity is a segment of, based on your upbringing, your nationality, your just what you've been exposed to in your life. So it's very interesting to see people open to the potential for a greater connection that is beyond the specific dogma of what they have been trained to believe.
Yes, correct. Although I have to say that it does sadden me to realize that while there may have been an attempt to say within some church organization of some sort, where the person somehow became religiously hurt, and then now that the very opposite of what maybe the institution was trying to impart with them has come true, and now they're cut off from their spiritual self because they're throwing the baby out with the bathwater. And I feel that that's terrible. But when I went through my training in pastoral counseling, they were very conscious of reminding, because aside from me, I was the only non-pastor there. I mean, I did get ordained for purposes of ritual blessing with water.
Right.
But it was interesting to see that and to hear that they were reminded to be careful of that.
Absolutely. So do you have something that you hope people take away with this understanding of pain that's not just physical, but emotional and spiritually connected? So is there a takeaway that you would have for people?
Yeah, I'd say get curious about sensations in the body. Get curious about whether you have chronic or transitory pain. Find a good somatic practitioner. Look out for the self-help workbook, which will offer you tools to help yourself, but that your body is not your enemy. Your body is your best ally, aside from your spiritual connection. And so when it is expressing itself, if you could develop the capacity to be curious and then allow yourself to stare off in some direction, see what comes to you. It's as simple as telling you, just go ahead and allow yourself to get into that daydream state, that open-eyed hypnosis spot. Just allow yourself to focus broadly and then be curious about those sensations in your body. More often than not, you'll find that they begin to lift, especially as new awarenesses come into for your attention. Then you will be able to make the connection between what your body is expressing and what you live through.
Yeah. And be open to receive the messages that come, because a lot of people are expecting the message to come a certain way. And when you allow yourself to receive, however it comes, like you're saying, have that wonder, have that curiosity without the expectation of a certain way that it's supposed to come.
Yeah, yeah, really beautiful.
Wonderful. So when is your workbook going to be ready, do you think?
Could be within the next 2 weeks.
Nice.
So we'll have to do a soft book launch.
That's great. Yeah. And I'm happy to review for you. I've written a couple of books myself and a lot of training manuals, and I'm working on some training manuals myself right now. So it is wonderful to have somebody else take a look at what we have created just so that we're just to support it, to support the journey.
That
So
would be so honored. Thank you. That's great.
if you would leave our listeners with one empowering message about their pain or their healing journey, what would that be?
An empowering message. Just that your body is your ally.
Mm.
And I would also remind you, take care of it. It is a divine gift also.
Mhm.
So take care of it with movement. Take care if insofar as you're able to. You don't have to do yoga. You could swim, walk, give it nourishing food. And then again, if you're having some unexplained sensations or pain, just take a minute and be curious. It's as simple as that.
And how do people find you? I'll put that all in the description, but
Oh,
you do everything online, is that correct?
I see clients in person as well as online.
Mhm.
And so you can see my website. It's Insight Healing Inc. That's Insight Healing Inc.com. And that way you can find ways to reach out to me, send me text or email, and any way that I can be of service to you or answer questions even. And Lois, I want to thank you so much for having me on today. And I really appreciate your thoughtful questions.
Well, thank you, and thank you for sharing your wisdom and your passion with me and with others. And realize, everyone, that this work is a beautiful reminder that pain doesn't have to be something we fear or suppress. It can actually guide us toward profound healing if we're willing to take the moment to listen. So if you're feeling stuck in pain, emotionally or physically, know there's hope. And there are new ways to approach healing that honor the intelligence of your body and your spirit. So be sure to follow Marianne to stay informed about her upcoming workbook. And you've got some workshops that you're doing as well, right?
Yes, I will be speaking on Psycho-emotive Anatomy as well as on G.F.T Flow at our upcoming National Guild of Hypnosis conference in August. And I'm speaking to several groups privately as well.
Wonderful. Well, I will see you there for sure.
Yeah.
So, as always, thank you all for joining us. And until next time, look up, stay positive, and be the light in someone's day. God bless.
Bless.